right, so welcome everyone to the 2017 Get Healthy San Mateo County Community Implementation Funding Webinar. I'm Jasmeet Sharma, your host and also one of the presenters for today's webinar. Before we start again, let's take a moment to ensure that everyone's ready and familiar with the webinar control panel. You should see a control panel on the left side of your screen. You can minimize this panel by clicking on the small icon in the upper right-hand corner. All participants are muted, but you have the ability to ask questions using the chat panel, again, located near the bottom of the control panel. Also, just to let you know, we are recording this webinar, and we will be posting this online on our Community Implementation Funding webpage on the Get Healthy website. So again, please be sure to keep submitting your questions during the webinar as it is in progress, and we'll be sure to answer as many of those questions as we can towards the end of the presentation. All right, again, I'm Jasmeet Sharma, Senior Community Health Planner with the Health Policy and Planning Program. Our other presenter for today is going to be Shireen Malikazwali. She's the Senior Manager for the Policy Planning and Equity at the Health Policy and Planning Program. What we thought we'd start off with today is, firstly, I do thank all of you for taking the time to join us today from your busy schedules. Your support and involvement is very crucial for the success of our programs. So we really appreciate your being able to join us on this online forum today. It's been a year since the release of our new strategic plan and priorities. So what we thought is we'd like to spend some time with you to review our mission and strategic priorities that we laid out for the next 5 years, and also report back to some of you on the efforts that we've undertaken so far to implement the strategic plan. Our second part of the presentation will be an overview of the RFP, the main reason I hope all of you are here. But I'll point out some key things about the RFP, specific application requirements, including a new and refreshed online application system that we've just put into place as well. I'd now like to hand over the control to Shireen to present on our strategic priorities and our mission as well.
Hi, everyone. Thank you for having me and participating in this webinar. I'm excited to see so many of you are interested in our Get Healthy funding opportunity, and I'm hopeful that you all continue to engage with us with or without the funding opportunity through our website, through our newsletters, and continue to be a key member of our collaborative. For those of you who are new to Get Healthy San Mateo County, as Jasmeet mentioned, we thought we'd just sort of step back and give you a little bit of an overview and then talk to you a little bit about what we've been doing over the last year since all of you and the community at large helped us identify our key priorities. Get Healthy San Mateo County is a collaborative. It's a collaborative of community-based organizations, of schools, cities, hospitals, and other leaders, as well as other county departments who work together to advance policies to prevent disease from happening in the first place and to ensure that everyone has equitable opportunities to live a long and healthy life. So one of the ways in which we differentiate from the health system, whose overall mission is to support folks to ensure that they live a long and healthy life, is that we focus at the policy and place location or level. So above, as you see, does this not work? So as you can see in this slide here, the health system in San Mateo County is large. The majority of our resources and our work and our focus is really around treating people and making sure that they have the medical support they need when they need it most. We also focus on medical support to ensure that people don't get sick. So that means when preventative healthcare measures like well visits for your kids, it's when you go in for a mammogram or a prostate check to make sure that we're catching illnesses early, we're preventing diseases through our medical care system. Then we also have divisions and departments that focus on education. We have a lot of that through our aging and adult, our family health services, even our nutrition programs, where we provide support for individual behavior change, where we help people understand what does it look like to eat healthy, how do you cook, how do you exercise, how do you take good care of yourself, so that as an individual, people can change their lives. Then what we do here at the Health Policy and Planning and Get Healthy San Mateo County is focus on changing places and policies to make the healthy choice the easy choice. So if, for example, we help change environments, we help change cities so that they're easier to walk and bike, and it's easier for people to have stable housing so that they can afford other things like good, healthy food, that they have fresh foods available. That's changing a place or policy to make sure that people can make good decisions about their behavior, and that the healthy choice is the easy choice. So key to our work is three really key frameworks. One is that we focus on place-based prevention. We realize that where you live and work impacts your health. Research shows us that. We know that if you give us your zip code, we can typically tell you how healthy or not healthy you might be. As an example of that, we show in our own county that there is a 19-year age difference. People in East Palo Alto live 19 years less than people in Atherton do. That shows us that place has something to do with how healthy you are. We also focus on health equity, precisely for the reason I just mentioned to you around how long people get to live. So there's something that enables parts of San Mateo County residents to live long and healthy lives, whereas some parts of our communities have bigger challenges around that. So in recognition of those communities that have larger challenges, we focus and support those communities to make sure that they have the resources and amenities that they need in their communities to make the healthy choice the easy choice. Collaboration is also a key focus of ours for two reasons. One is that our agenda is really broad and big, and we need support across disciplines to advance and meet our goals. But it's also a key value. So in addition to just being practical for how we work, we also really value the fact that people know their communities best. Those that are in their communities, that are leading community work, know the aspirations of their communities, know the needs of their communities, and can advocate and support and advance those better than we can, and certainly that in partnership. So we partner with cities, community-based organizations, leaders, and others to advance the Get Healthy San Mateo County agenda and ensure that they are helping us set our agenda. Towards that, we went through a collaborative community-based prioritization process last year where we identified the key priorities for Get Healthy San Mateo County as a collaborative. There were 4 key priorities. There were 10 key elements of a healthy, equitable community that you helped us identify. And that included 4 that was ultimately prioritized through a survey and further engagement with community members. The 4 that were prioritized were stable and affordable housing, complete neighborhoods, high-quality education, and a strong local economy. So what you told us is that of all the elements that create a healthy, equitable San Mateo County, these 4 were the most important to ensuring that you and your families could live long and healthy lives. So what we know is that these 4 elements are key to ensuring the health of San Mateo County. So as an example of that, what we know is that over 6 million housing units put kids at greater risk for health issues. We know that we continue to have challenges with, folks engaging in regular physical activity, that our kids are seeing the worst of it. We have 1 in 3 kids are overweight and obese in San Mateo County. Now, across the board, we see that people who have a high school degree, that education and chronic diseases are correlated. So when you have more education, you have less chronic disease. This example you see on your slide here is on points out diabetes, something that is highly on the rise across the United States. Those with a high school degree versus those with higher education have a far higher likelihood of getting diabetes. So 1 in 11 chances of getting diabetes if you have higher education versus 1 in 7 if you only have a high school degree. In addition, a healthy economy, we know that income matters to health, and that's somewhat incremental too. So the more money you make, the healthier you tend to be. We see that really prominently when we look at places like Atherton and East Palo Alto. Atherton has a median income of about $240,000, whereas East Palo Alto has a median income of about $54,000. And you see people in East Palo Alto dying about 19 years earlier than their counterparts just a few miles away in Atherton. So we know that income matters, that education matters, that where you live and the neighborhood amenities you have matter to you, and that the more stable your housing is, the healthier you are. So how you do your work, how we do our work, again, focuses on policy, prevention, and equity. And we do that work by engaging actively in policy discussions and policy processes, also in urban planning processes. This includes things like comprehensive or general planning processes within cities, precise or specific plans around stations like the Millbrae Station area. We provide funding to you in recognition that this is a collaborative and we can't do this work alone, and that for community-based organizations, for cities and nonprofits, it takes funding to be able to work on these critical issues. So we try to provide as much as we can every year. We conduct research in support of policies to better understand and have evidence-based policy actions. We support building capacity in our partners in building their leadership to advance work as necessary, and partnering on issues that matter most to our community-based organizations and partners. So you can tell us if there's something that we need to be doing with you to advance the work, and we love to hear from you all. We also engage in communications work. So that means we have a monthly newsletter that goes out. We are active on Facebook and Twitter and hope that you're joining us and joining the conversation. We provide presentations as requested to cities on various issues related to the priorities of Get Healthy San Mateo County. We conduct reports and other publications that feature our policy and research work. When you look at that in action, what you see across our priority areas is over the last year, we've been figuring out, okay, you set our agenda back in October of 2015, and now we are in the process of implementing it. So in implementation, what we've been doing around healthy housing is meeting with our department's housing office, with our planning department, our county Office of Sustainability, and some citywide work around housing, and saying, how can we bring a health perspective to your work? Part of that's been introducing a 5-piece solutions framework. Because the issue is so complex and so many of our partners from low-income communities to teachers to police officers to middle-income folks are really experiencing challenges with housing, we know we need a comprehensive solution framework. We're introducing the 5 Ps. That includes the placement of housing near amenities and transportation, preservation of housing affordability, production of new housing at all income levels, including affordable levels, protection of residents from involuntary displacement, and participation of our most impacted communities in housing decisions that impact their lives. We've also been engaged at the regional level in conversations and policy work related to climate change that dictates the relationship between transportation and land use planning. So where will our housing go across our 9-county region in the Bay Area, and where will our transportation systems go? And we have been very supportive in trying to actively advance the 5 Ps through the regional work. We are also responsive, as I said, to partner needs. So we had a request recently around what the literature or what does the research say about the relationship between evictions and health, and we put together a literature review and a document that we shared directly with our partners. These give you a sort of a taste of the kinds of work we're doing, but certainly we're doing more than just these. For healthy neighborhoods, we have been all engaged in local land use processes, as I mentioned to you, general planning processes, precise plans, things that look ahead over the next long term and actually plan how cities will develop. So literally how the environments around our communities grow over the next 20 years or so. We engage in those processes to make sure that health is considered, that healthy communities and the way in which they enable people to walk and bike and have stable housing and good jobs are included in those conversations. We've been working on a transit efficiency project, so looking across San Mateo County and saying where do we lack public transportation for people to get to school, to get to jobs, to get to health care, to get to grocery stores for healthy food access, and where do we need to increase our public transportation opportunities. We've been looking, working with partners on a food and farm bill. This is sort of analogous to the federal process of identifying a food and farm bill, where we're looking locally at how can our food systems really support positive opportunities for local sourcing of food, for the healthiest foods, for the most affordable foods to be available to our residents. We're also exploring locally sourcing food to institutions. So we've got a pretty robust agricultural community here, and we are wanting to connect them to institutions like schools and hospitals that also are looking to increase how healthy their food is. We're engaged in research across all of our areas, and for healthy neighborhoods, the examples I'll provide is around the transit deserts, as I said, identifying where we need more transportation, public transportation options. We're also looking at where bike and pedestrian collisions are highest and supporting cities to improve their safety measures. For healthy schools, we have been working, we have been co-facilitating with the County Office of Ed, a School Wellness Alliance, where we bring together folks in the school and in the wellness field together 3 to 4 times a year to talk about issues and build capacity in our school and wellness leaders. We manage the Youth Commission, which provides a voice for youth in our decision-making processes. This is a group that comes together and says, youth have a vision for San Mateo County, and this is what it looks like, and we advance policies related to their vision. We also have been supporting in research, adding a new module to the California Healthy Kids Survey to better understand what the health of our students are and to be able to track that over a longer period of time. We will be doing outreach to communities to our school allies to make sure that we get as many schools as possible participating in that survey. For our healthy economy work, this is probably the newest arena of work for us, and we continue to look for opportunities to expand our work in this arena. One way we've been supportive is that there's been a number of cities, including the city of San Mateo, that are looking into wage policies. What we're doing is they're reaching out to us, or we're reaching out to them and seeing whether or not they could use any support as they explore wage policies, whether it is bringing a health perspective to the conversation to share how important a steady and good income is to health, or it's looking specifically at some of our health inequity numbers and seeing how we can advance wages to improve our outcomes. We've also been looking at workforce development. So looking internally at ourselves and looking at what career opportunities there are, we've been looking at the emergency management technician as an opportunity. It pays a good wage, and what we'd like to do is pilot a program where we're supporting our most disadvantaged communities to have the training and certification they need to become EMTs, to diversify the workforce and have opportunities to make a living wage for their families. We're also been doing research in this arena and in response to community and city requests. And one research we have recently completed was looking at what do low-wage workers look like across San Mateo County? What are the demographic profile of that community? Finally, I've been mentioning research, but we've been doing our best to also come back and share what research might be interesting and available and accessible to our collaborative members. And that's been mostly focused through our new data portal. What we have done, and if you haven't already, please do visit our website and go to the data page. You'll find baseline data on across all of our 4 priority areas, in addition to looking at demographics of San Mateo County, as well as health across San Mateo County. And we've worked really hard to provide maps and interactive opportunities. As you see here on your webpage, this is an example of the demographics page where you can click in to the map and delve deeper into certain geographies, whether it's at the city or a zip code. You have links at the top that you can click into where you see age. There's a tab for people of color, where various races are located in San Mateo County. And as you scroll down further, you'll also see that we include charts and graphs. So you'll see that across all of our 4 priorities in addition to demographics and health. We're also in the process of adding new indicators as well as creating separate profiles for each individual city in San Mateo County. So what you look at right now in our indicators is a county-wide view with maps that show what they look like at the city level. Our plan next is to actually identify a profile for each city, so you can go in and click on Daly City and get an overview of that, how well Daly City is doing in relationship to the 4 priorities that you've identified for us. So I hope that that's given you a flavor of the types of work we're doing to support your vision and priorities around what it takes to build healthy, equitable communities. And we hope to continue to work with you to be able to advance those 4 priorities. And a huge way that we do that, as you know, is by providing the funding necessary to keep nonprofit organizations going to advance the goals of Get Healthy San Mateo County. With that, I'm going to turn it over to Jasneet, who can share details about our funding opportunity. I hope all of you reach out to us if you have questions. I think we do have time at the end of this session to answer questions, and I look forward to that. Thank you.
Absolutely. Thanks, Shireen, for that quick recap of our priorities and the efforts that our program has undertaken in the last year to move the needle forward on some of these priorities. I'd like to now give a brief overview of the community implementation funding, the application, the guidelines that we have put in the RFP as well. So give us a second. We'll go right back to the screen. Just give us a second there. All right. So as a lot of what Shireen already shared about our purpose and the frameworks, I'm not going to go into the details of that. But really, the funding is to improve, the purpose of the funding is to improve the health of San Mateo County residents through policy and systems change. As she has mentioned when she was talking about the framework, our work is really focused on what we call place-based primary prevention, and the example that Shireen gave around how people's health outcomes depend by the zip codes on which they live in. So really what we're hoping to achieve through this funding is a focus on place-based primary prevention that seeks to create healthy places that reduces the chances of people becoming sick in the first place. Health equity is another key aspect of this funding opportunity. So as we've shared so far, not everyone in San Mateo County has the opportunity to live a healthy life. We've seen that low-income individuals and people of color face the worst health outcomes in San Mateo County. So from a health equity perspective, The focus should be on populations with a higher percentages of preventable health issues and on places that have fewer opportunities for good health. Projects. So let me talk a little bit about the type of projects that the funding can be used for. This is listed in the RFP as well, but the funding can be used for some of the following type of efforts. They could be community education or engagement, capacity building projects, any city or regional planning process that you'd like to engage in, action-focused research. So while you might be researching a specific issue, but then also thinking about is how are you going to implement that research or put that into action to move, again, the needle forward on that primary prevention and health equity aspect. Is there some kind of policy or systems change that might happen through the project that you're thinking about? Or the funding can also be used for technical assistance at the local level within a city as well. So it could be used for any of these types of projects that I've mentioned. And like I said, this is listed in the RFP document as well. We have about up to $150,000 available to give out as funding this year. In the past, funding amount for projects have ranged anywhere from about $5,000 to $35,000. But I must add that funding at that higher level of $35,000 is only given to one or two projects. So we do not give out a lot of funding at that higher level of amount. In terms of timeline, projects can start at the earliest in January. So as of January 1st, if you are awarded funding, the money will be available for you to start the project, and they must end by December 2017. Now, this may look a little different for schools. There are some schools that might want to start a project as early as this year when the session has started, which is perfectly fine to do. But if you are selected as a recipient, know that the funding will only be available in January, but not before that. And the activities or your timeline or the work plan from January to December should include everything from completion of activities to conducting the evaluation and then the reporting as well on the project. I'd like to talk a little bit about the applicant eligibility and the project eligibility as well. So any nonprofit, faith-based organization, a city, a school, a group of individuals, a program, just about all of these are eligible to apply. If you are selected as a funding recipient, you'll have to sign a contract with the county health system. If you are a group of individuals or a program that is not part of an organization, then you must indicate a fiscal sponsor that will be able to sign the contract on your behalf and also manage the funds on behalf of your group. Again, when applications are submitted, we do screen them for basic project eligibility. What I mean by that is internally we go through the applications to see that at a minimum, does the project address one of the 4 Get Healthy priority areas? So as Shireen mentioned, healthy housing, healthy neighborhoods, healthy schools, and healthy economy. Does the project adequately address one of those 4 priority areas? And how adequately will the project help achieve one or more objectives across those priority areas? To what extent, or does the project align with the Get Healthy San Mateo County framework, which was the place-based primary prevention and health equity framework? We're interested in seeing to what extent it meets that. The third aspect that we look for when we screen applications is the project focused on priority populations? So from a health equity standpoint, if you remember, I had mentioned that not everyone has equal health outcomes in San Mateo County. Low-income populations, community of color that live in neighborhoods with limited opportunities often have higher rates of preventable health issues like diabetes, asthma, obesity, or even older adults, children, and persons with disabilities often face very specific challenges to healthful living, such as access to their daily needs, services, healthy foods, transportation, housing. So the project will be screened to see whether it focuses on priority populations, or that is the focus of the project as well. So there are certain types of projects that the funding cannot be utilized for. If it's for an existing program or staff position without really seeing an expansion of their current responsibilities, we cannot continue to support ongoing operations. If there are individual educational classes, so like nutrition, cooking, dance classes, safety and fitness classes, funding cannot be used for those individual behavioral change classes. However, train the trainer and capacity building models such as training community leaders to lead education work within the community, or even training school teachers to lead some of the work within the school system are eligible for funding. Partial funding for a project for which majority of the funding has not been secured. So while we do not require a match for the funding, we do ask that if you're asking for partial funding for a project, you should have secured the other portion of the funding, the match funding as well. The major beneficiaries should not be outside San Mateo County. Another important aspect is that any county department, so any San Mateo County department would not be eligible as a primary applicant. So if the project has a school, a city, a CBO, or a nonprofit as a lead applicant, and a county department as a partner or a collaborator, that would be perfectly acceptable. But funding is not available for county departments as lead applicant or to fund salaries of county employees. And if your indirect expenses are over 12%, we would just request you to keep that aspect in mind, and if you're applying, keep your funding indirect expenses under 12%. There is a projects funded to date document on our website, so if you'd like to know more about what kind of projects we funded in the past, you will see a list of projects funded all the way from 2011 to through 2016. Some application requirements. So like I said, I've already talked about to what extent the project advances health equity, and you'll see a question in the application related to that as well. It'll ask you to identify, again, to what extent is the health of the impacted population or the vulnerable population being improved or impacted. There are questions in there which ask you about alignment with Get Healthy priority areas and the objectives as well. The third piece really is the likelihood of policy or systems change. That is a question there as well, and that's a really key portion of the RFP as well, is identifying how your project will lead to that long-term policy or systems change. And then I'll go into a little bit of the details about the project outcome and assessment methods and some of the criteria that we ask questions around and that is used in the review process as well. So I just want to take a little bit of time to talk about the policy or systems change aspect. Policy and system change goes beyond just basic programming. It's really seeking to change the underlying conditions and structure in any community. A policy change could include a law that's passed, an ordinance, a resolution, or any rules that are put in place. And a systems change essentially involves a shift in the way an institution functions or makes decisions. And I've given some examples there. Say an organization puts in a policy which says 30% of all food will be would be food that's locally grown, that is procured by them. So the application is going to ask you to what extent the project is going to lead to that policy or systems change, and then it's going to ask you for some outcomes and how you're going to measure your success towards achieving that policy or systems change. We do understand and completely acknowledge that policy and systems change cannot happen within the one-year time frame for which we give the funding. So we are not expecting that to happen completely, but there are certain interim measures that can happen, or milestones that can be achieved along the way that would lay the foundation for long-term policy or systems change. So what we're really asking you from an outcome standpoint is to identify those interim measures that will help us see if the needle is moving towards long-term policy and systems change. We have put together a document to help you identify some of these outcomes. Typically, policy and systems change can result in these 5 types of outcomes that I've listed on the slide. A shift in social norms, which is essentially a change in people's knowledge, awareness, attitudes, or values. We could see strengthened capacity of groups or organizations, which could be through leadership, applied skill building, or strategic planning and trainings as well. We can see a strengthened base of support, which is essentially more public involvement on an issue. It could be through coalition building, media campaign, additional policy analysis. It could actually be a direct social or physical condition or an environment that changes, so a new pilot program or a service that's put into place. And lastly, a policy level change, which could be indication for policy support, a new policy that's in the process of being developed, the policy is actually adopted, or even implementation or enforcement of a policy. So like I said, that we have put together a document that's on the community implementation page on our website that identifies the type of outcomes that you might see from your policy and systems change work, what kind of strategies you would use to achieve those outcomes, and then what kind of measures can help you evaluate those outcomes or measure the level of success you've had. I just quickly want to share a brief example with you just to kind of show you how we're thinking about this. So this is just an example where, say, the organization is looking to evaluate and assess bicycle routes within the community. They want to educate youth and families on biking issues and support local youth efforts to increase access to safe local bike trails and routes. So in this case, the project objective would align with what's under the Get Healthy Neighborhoods priorities, where everyone has access to efficient and affordable public transportation and safe walking and biking conditions. In the application, this is just an example of how you might lay out your work plan and your timeline as well. So you would identify each activity that would take place, and then you would identify the time frame for completion of each activity as well. With regards to project outcomes, what is listed in the heading of this table is exactly what you'll see in the application. So when you get to the outcomes question, it's actually going to ask you to list out the expected project outcomes, what strategy you are using that will help you achieve that outcome, what's the output that you're seeing from the strategy that you're using, and then how are you going to assess your level of success. So in this case, you can see from the project example we've given is that there might be a shift in social norm based by all the training and the education that happens. The strategy they were using was a bike rodeo. Kids were going to participate in Trips for Kids programs. The output here would be essentially the number of people that are participating in that program, and they were going to use paper forms to track the number of students that were participating in it. Another example of what might be an outcome from such a project would be an improved social or physical condition. So as part of this project, youth were going to go out and assess a couple of potential routes that might be designated as bike-friendly routes in the community. So they were going to do an assessment of existing conditions, and then they were going to assess potential quiet routes in the community. The output here in this case was a proposal for sign installation, and then they were going to make a presentation to decision makers. And then the assessment, how you would measure the assessment would be once this information was presented, what kind of level of support or what action did the decision makers want to take on that aspect. So again, just a quick recap. What we're really asking you to look at is, or give us information, is on the project impact. Project impact, again, just to remind you, is the extent to which it advances health equity, the likelihood that the project will achieve Get Healthy objectives, and then across what kind of priority areas. There's also questions in there about opportunity for change. So what we're really asking you is, why is this a good time to take this project on? Is there something happening at a local level that makes this an opportunity, a good time to take on the project? Then project success, we're really asking you is to tell us a little bit about your organizational capacity. What kinds of skills, capacity, and resources does your organization have to undertake the project? With project feasibility, we're going to be looking at effective work plan, timeline, and the budget as well. Operational feasibility is the extent to which the project can help solve the identified problem. So what's the approach that you're putting forward and how that will help solve the problem? And then what kind of partnerships and coordinations do you have in place? So there is an optional question at the end of the application which says, are there any partners or collaborators in this project? We have a couple of questions related to what role the partners would play in the project, and then you can also attach a letter of support from the partners who are engaged in this project with you. Also, we will be seeing what kind of innovative approach, the kind of approach that you are utilizing to address the problem, and then again, the application requires you to identify the outcomes to evaluate whether objectives were achieved. So if you are awarded funding, there are some participation monitoring and reporting requirements. There's quarterly check-in phone calls that you will be participating in. You'll have to do a progress report at 6 months and then a final report once the project wraps up in December. And then we request you to attend 2 of our Get Healthy, Building Healthy, Equitable Communities forums, one of which happens in spring, sometime in March and April, and the other one which happens usually in the August time frame when we release the RFP as well. As I pointed out in the beginning, that we do have a new and improved online application system. So your applications are due September 21st, again before 5 p.m. And the reason we say before 5 p.m. and not at 5 p.m., that we just want to make sure that you should know that at 5 p.m. the system will shut down. So just because you're in the system does not mean you'll still have the ability to submit it at 5 p.m. So please be sure to submit it before 5 p.m., and that's why we've called it out that way. This time we've given the additional ability for people to create a login so you can access your online application. If you prefer working within the application itself, this will give you the ability to do that. System allows you to save the application, like I said, but it does require you to submit a request to create a login. So we at the back end need to create a login for you. Once you request that, within 2 business days, we will send that login information back to you. You can certainly change your password as well if you'd like to. But this is just to say that please do not wait to send us the request to create the logins. The sooner you do this, the better, because closer to the end date, we might be getting a lot of requests, and we don't want to miss requests from any of you. So I'm quickly going to actually jump to our website to show you where you can request that login and what page you would go to actually access or fill in the application as well. So give us a second while I share the web browser with you. So this is where we are on the Community Implementation web page. Once you go there, on the left-hand side under the Community Implementation Funding tab, you see the Apply for Funding tab. Please go ahead and click on it. Once you get there, you will be directed to the set of instructions, where the first set of instruction essentially says request your login. So if you click on the request your login here, it'll take you to this page, which is a really short form. It asks for your first name, last name, and your email, and you would essentially click submit, and the request to create that login would come to us. Once you have that login with you, you can actually, if you scroll down to instruction number 3, which says access the online application, you can either click on that and it'll take you to, give you a second while the page loads up. It'll take you to a page that looks like this, where it asks for your login information, your username, or your password. Or there's another little pod on the left-hand side, so the pod which says looking for funding application. You can also click on that and it would take you to the same page. So I'm going to find my way back to our presentation. The other piece I wanted to point out was that we also have a PDF and a Word version of the application on our website. So before you even start filling out the application, if you want to see beforehand what kind of questions are there in the application, what kind of information do I need to have on hand before I start filling this out, you can either download the PDF and view it, or if you prefer to work out of the Word application and then just cut and paste your final responses into the online application, we've made both of them available, so you can choose whatever works best for you. So we did go through the online application system, and then just a little bit of information on the review and the selection process. As I'd mentioned, the applications are screened internally by topic area experts, and then we have an external advisory committee that helps us review and score the applications. Award notification would be by the end of November. We do have the FAQs, the frequently asked questions, on our Get Healthy website. Any questions that are asked here today as well, and if they were not already a part of the FAQs, we will be sure to add it to that FAQ and update the document on our website. And then if you need any technical assistance as you're thinking through any of your projects, or even once you get funded, we're always there to help provide technical assistance on strategic thinking or any resources that we can share with you. So once again, that's the link for you to download the RFP or the application, which I'm hoping all of you have already either done or know where to find it. If you have additional questions, you can either directly email or call me, or you can also follow up with our program coordinator, who can also help answer many of your questions, or can direct your questions to the right person within our team as well. So thank you once again for joining us for this online session today. Again, I'd like to point out that you can join our monthly newsletter or join us on our Facebook or our Twitter page. And I'd now like to open it up for question and answers as well. So why don't we give everyone a couple of minutes to write their questions while we start finding our way to the questions on the website. So give us a second while we just try to make that window a little bigger for us. Okay, so the first question says, can you give us a reference to learn more about the 5P solutions framework, please? Absolutely. It is on our website. So if you go under our priorities on our website and click on the Healthy Housing page, you will see the 5Ps document. It's on our website there, so you should be able to find it there. And again, if you are unable to, please just send us an email, and we would be happy to directly email you a PDF of that document. The next question says, what if we wanted to implement an ordinance that is on the November ballot? So
You know, I think the one piece that we should be really clear about is that, this is Shireen, by the way, and thanks Justine for the wonderful presentation. I'll be joining her and responding to the questions that you all have. It's a really great question, and for us the challenge is that as a government entity, ballot measures in particular, not always legislative policies, but ballot measures that directly go to the voters are a little bit tricky to participate in, and that includes extension of us through the funding work. So ballot measures are not ones that we can typically fund. That said, education, efforts that educate the population about issues related to health. So there might be aspects of the work that are related to your campaign but not directly part of your campaign that could apply and be useful to you. So if that is helpful and you want to talk through more of that, please do give us a call directly and we can talk more about it.
The next question we have is, it says, can grant funds be used to attend the required community events? I'm not sure I completely understand the question.
If the question is related to using the funding for transportation, for example, to the forums or to fund staff time for the forums, those are two separate questions. Transportation would not be covered, but staff time as needed, if it was part of the, because it's part of the work that we're requesting, can be allocated. Funding for the staff time can be allocated from the grant.
And again, if we were not successful in answering that question for you, please go ahead and just provide us a little more information and we'll be sure to address that question. The next question says, we've registered for a login but have not received any information yet. Should I try again? And I see the name as Jennifer. Jennifer, we're actually going to make note of your name as well, and we do have your email address when you registered for the webinar. So please be on the lookout. We will be sure to see. Maybe we have not received that request, so we will follow up at our end. But I would also suggest if you could follow up directly with Rosa Torpes, who was our program coordinator. You can find her email on our funding webpage. Please email her directly, and she can make sure that the login is created for you and you get that in a timely manner.
We have a question from Matthew about whether or not the funding is all or nothing. So if they requested, for example, $10,000 and that was too large of a request, would we let them know that they would be eligible for a lower amount? And the answer to that is yes. To the degree possible, if you can parcel out your application so that if it's in phases or if it's in portions that don't necessarily have to be done in sequence for the project to be successful, that helps us better understand what portions we could fund and could not fund and to what differentiating levels.
The next question is, what is the average grant award amount? And I had mentioned this earlier, but it's ranged anywhere from about $5,000 to $35,000. So like I said, we don't offer a lot of funding at that higher $35,000 amount. But like I said, it's really varied, so I can give you the range. The average amount would be really difficult to give just because every project is so different and everyone requests a really different amount.
And we have a clarifying question from Ellen about the ballot measure question that she was requesting actually information about applying funding for implementation, not for the actual advocacy for the ballot measure. And the answer to that is yes. Once a policy is in place, the implementation of that policy then is certainly up for funding through this work.
So we have the next question from Jennifer is a copy of the contract successful applicants will sign available in advance? The contract is actually, there's no standardized contract for applicant that's funded. The contract looks very different for every applicant. So I'm not sure what might be gained by looking at the contract specifically, Jenna, but if you want to contact me or have a conversation with me offline about this, I can certainly share. But really what goes into it is, since it's a county contract, there's a lot of other legal requirements that come with it as well. So again, contact me offline and I can certainly provide more information to you on that.
And just to follow up on Disney's good answer, we can give you a template for what the contracts look like, which includes the boilerplate language from the county as a whole. If this is particularly, if your question relates to legal ramifications and contracting with your institutions, I think that boilerplate language could be useful, even if it doesn't include any kind of scope of work within it. Okay, we have about 3 more minutes for questions, so please do chat in your questions. If you have chatted in your question and we haven't answered it in full, or you have want more details, feel free to do that as well. This goes without saying, but if you haven't done it yet, you have a full screen with our website on it and a way to join us on Facebook and Twitter, as well as join our regular email newsletter. We only send out, we don't spam anybody, we send out 1 newsletter a month, and probably over the course of the year only send out maybe 5 or so additional announcements in addition to the newsletter itself that are vital, something similar to the release of our community implementation funding opportunity. We'll pause just another minute to see if anyone has any questions that come up. Okay, we've done such a good job going over the application that we've probably answered a lot of your questions, or I hope that's the case. If you're feeling shy to chat in your question, or if it feels too detailed for a chat, we are very available to answer questions. You should definitely check out our frequently asked questions document that's available on our website as well. Just as a reminder, applications are due September 21st. Before 5 p.m., please heed, just needs urgent calling to make sure that you're not waiting to press send at 4:59. That the application will close down as those seconds unwind. So please do make sure you get it in before. And because we're using an online system, that you are signed in, that you don't have any troubles with your internet access, and that you're able to ask us questions, follow up with questions for us if you end up in the application and have any challenges. So with that, we thank you for your participation and look forward to receiving your applications. And if you can, go ahead and log in as soon as possible so that you are able to get signed up and that we know who you are and your interest in applying.